All right. Welcome everyone to this third session of our Global Health Catalyst webinars. We are glad that you're joining us this morning or afternoon or evening, depending on your time zone. My name is Kenneth Ngwa. I am the faculty at Garrett Evangelical Theological Seminary and the director of the Religion and Global Health Forum. Our focus today is religion and whole person health. In a moment, I will introduce our wonderful panelists who will guide us through today's topic, but I wanted to just begin by inviting us over the next 30 seconds to a minute to just be in reflective mode as we recognize the season for many persons of faith around the world. Our Muslim brothers and sisters are observing Ramadan, which is a time of faith and charity, zakat, and forgiveness, and hospitality, prayer, community, service to one another. And this coming Wednesday, members of the Christian community will also begin with Ash Wednesday, which is also a time of deep reflection, service, experience of faith and forgiveness. And so these are two of the Abrahamic religions. And later on in the year, we'll have opportunity to also celebrate with Jewish communities and other religious traditions, as each of them invite us into a space of reflection around our shared sense of purpose, humanity, and connection to the divine. So we know that advances in modern scientific medicine and a kind of a revitalization of spirituality and religion give us opportunities to reimagine our definitions and our understandings of human life and to face with renewed urgency and determination the challenges of global and public health that continue to plague our world. We all know that chronic diseases remain unsolved. Historically marginalized, underserved communities continue to suffer from social disease and traumas that require medical, religious, and cultural competencies to diagnose, to address, and most importantly, hopefully, to prevent. And the wider experiences of human suffering and aging and the realities of natural or violent death continue to raise questions about the value and the meaning of life and how to care for one another. So these questions, they touch on whole person. There's a human body and its constituent parts. So the heart, the mind, the spirit, the brain, the kidney, the lungs, the womb. How do we treat our whole bodies? Then there is the social and religious body and its constituent parts, our faith, our culture, art, music, ethnicity, race, gender, history, education, family. How do we hold that together? And then there is our ecological body, the water we drink, the air we breathe, the plants, the food, the economy. How are we connected to those bodies? So this is some of what we are going to try and address during today's webinar. And I would just say one of the leading scholars in this field, Jeff Levin, has said that there is scarcely a disease that has not been studied in relation to religion. And I would add that there is scarcely a form of healing that has not been studied in relation to spirituality and religion. So how should we think about whole person health? How should we, members of synagogues, mosques, churches, religious communities, organize ourselves? So our panelists today will help us, and they will speak to the ways in which we understand this work and engage in it. The acronym that we use is CARE, C-A-R-E. C is for care, A is for advocacy, R is for research, and E is education. So they will help us as we navigate some of those. And please use the Q&A function to type in your questions, and the chat function to engage in community dialogue as our panelists present. So let me introduce them, and they will lead us through our session. I will begin with Rebecca Adnafu-Boyer, who is MPH, the founder and CEO of R&D Associates, Inc., and a research associate at the Johns Hopkins School of Medicine. Her expertise covers leadership development, systems design, sexual health, adolescent health and development, youth development, and after-school quality systems. She has conducted research studies on cancer prevention and screening behaviors, as well as public health strategies aimed at addressing systemic and sociocultural barriers to health and wellness. Rebecca has collaborated with a variety of community partners, including faith organizations, barbers and beauticians, schools and universities, youth development programs, and other community-based initiatives. She is deeply committed to mentoring and serves as a faculty advisor to the Africa Business Club at Johns Hopkins Carey Business School. Additionally, she leads Zenith Gift, an initiative she founded to provide academic and professional development guidance to students and professionals, particularly those from her home country of Ethiopia. Rebecca holds a bachelor's degree in biology from Binghamton University and a master's degree in public health from Columbia University. She is a member of the Baltimore Ending the HIV Epidemic Commission. She's a proud mother of 2 sons and a stepmother of 2 daughters, and she cherishes her beautiful blended family. We also have Dr. Tracy Balboni, MD, MPH, FAAM, HPM, who holds degrees from Stanford University, Harvard Medical School, and the Harvard School of Public Health. She is board certified in both radiation oncology and palliative medicine. Dr. Balboni serves as professor of radiation oncology at Harvard Medical School and as program director of the Harvard Radiation Oncology Program. She also co-leads the Initiative on Health, Religion, and Spirituality at Harvard. Dr. Balboni's primary research interests are located at the intersections of oncology, palliative care, and the role of spirituality in life-threatening illness. Our third panelist is Dr. Arthur Presley, who is Associate Professor of Psychology and Religion at Drew Theological School. He is a past president of the New Jersey Association of Black Psychologists. For 10 years, he conducted one of the largest studies ever in pediatric psycho-oncology, leading a research group that evaluated 118,000 children living close to the Chernobyl nuclear power plant. The study investigated the relation between childhood depression and trauma, thyroid cancer, and low levels of radiation. He later worked to develop healthcare programs for children of Ukraine with various cancers, coordinating the efforts of school systems, hospitals, and social support programs throughout the country. In the past, he has conducted neurological assessments of persons with severe head traumas. He teaches classes in children and autism, psychological oncology, children and trauma, and pastoral care and counseling. And he has been a pastor in Washington, D.C. and Chicago. So those are our wonderful panelists. And at this time, I would invite them to take turns and just share with us, help us think through this question of religion and whole person health. What should we be thinking about when that topic comes up? We'll begin with Rebecca and then Tracy and then Art.
Okay, great. So I'm gonna share my screen for this presentation. So if you can give me the ability to do that. Okay, so I'm not able to share my screen. It says host disabled to participate screening. So if you can let me share my screen, that'd be great.
Sure, 1 second, please.
Sure. Okay, now I'm able to. All right, can you see my screen okay? Okay, beautiful. Thank you so much for having me, Kenneth, and glad to join Art again on a panel, and nice meeting you, my other new panelists that I'm just meeting today. And it's a beautiful Saturday morning here in Virginia, and it's great to be here talking about a subject that I'm very passionate about, and that's religion and the whole health. When I think about that and this glorious day, as I go out and just welcome the sun and lift my eyes out to the sky, the beautiful sky, and just silently admire nature all around me, it completely fills me with joy and admiration, this beautiful world that God has created, and makes me lift my head up and hands up and thank God for another beautiful day and for the health that He's provided for me and for everybody else, and for giving us the grace and opportunity to be together here today to talk about the importance of health and whole health and religion. So I want to start at a basic level and at a very important level, and that is every Christian should know, right? The prayer of, our Lord's Prayer, okay? And we start off by saying, Abba Tachin Hoy, Besemayim Metunor, okay? Our Father. The first and foremost as Christians, as religious practitioners, is really recognizing our Father as being in charge, our Father in heaven is being in charge of us and our lives here on earth and also in heaven. And it's that spiritual connection that is really important, and start off our day, start every prayer with acknowledging that He is our Father. He is the one who is taking care of us, nurturing us, and guiding us. And hallowed be thy name, thy kingdom come, thy will be done. That thy will be done is a point of relief. Okay, you ask God for anything that you want and just leave it up to Him, because thy will be done. Whatever God thinks is right for us will be done. All we have to
Can
do
you
is
share the full screen? Can you share your full screen so that
Oh, sorry, I thought
Yes.
I did that. I apologize. Let me know when you see the full screen.
There you go.
Okay, all right. Yeah. So thy will be done. Thy will be done is a mental relief for us. Okay. There's so many things embedded in this Lord's Prayer that is about mental health, spiritual health, soulful health. It's about physical health. Okay. So thy will be done is no matter the pressure all around us, you ask God for guidance and just leave it up to thy will be done. Whatever He says will be done, and acceptance of that is very important. And give us our daily bread. When we say give us our daily bread, it is not just bread alone. It's all the basic necessities, not the extras, not the luxuries, but the necessities that we are asking God every single day. just like Maslow's theory, is the basic necessity, the foundational things that we need, the physiological things that we need, the air that we breathe, the food, the water, the shelter, the clothing, the sleep. That's what we're asking God when we say, give us our daily bread. All those things are things that we need for not only our physical health, but also our mental health as well. And mental health and physical health go hand in hand. And of course, religion and the prayer goes hand in hand here as demonstrated. And forgive us our trespasses. Forgiveness is one of, Art will agree with me, forgiveness is one of the most stressful burden that we carry if we do not forgive people that trespass against us or do us wrong. It is a very, very debilitating emotion, not being able to forgive. Okay, so forgiveness, giving us the power to forgive others so we can move on with our lives is very important. Otherwise, we live in bitterness that debilitate us mentally, emotionally, physically, gives us a heavy heart. Okay, and lead us not into temptation. All those temptations, that drinking temptation, pornography temptation, substance abuse, just please help us, lead us away from the temptations that will destroy our body, that will destroy our families. And then forever and forever, dear Lord, be with us. So in that one prayer, Jesus taught the disciples and everybody that gathered at the Sermon of the Mount, that a very important prayer that he gave us is about everything that we need for our spiritual health, our physical health, our mental health, all encompassed in one, and supported, of course, by Maslow. It should go the other way around. Maslow supporting God's teaching about us. When I think about medicine and patient and care and faith, I remember the segment in New Amsterdam TV series on emergency room. And a doctor was going to be performing heart surgery on a Haitian patient. But her and her family wanted actually spiritual intervention before going into surgery, and the surgeon denies, like, no, we don't need that. We don't need that. He kept discounting, and every time he tries to pull her into surgery, her heart it just stops, and then they wheel her back in, and then she brings her back, and then again when he tries to take a surgery, the same thing happens. So finally, his colleague says, why don't you just let this happen? Let her have the ritual that she needs. And she says something that's very important. The ritual isn't even about you or what you believe or your abilities. It is about her, the patient, and what she believes and what she needs. Why can't you give her that? If I were you, I'll take all the help I can get. Okay. So when we let our patients, when we accept the patient's faith and religion and ability and desire to practice, and as a physician, as a health provider, you acknowledge and give space for that, you are actually helping yourself heal the patient that is right in front of you. Okay. And so I urge you to look at that segment, because I think it was so well done about the interconnectedness between medicine and patients and faith. We can't just leave faith alone. And some of the research that I've done and cancer prevention, cancer communication, and doing focus group discussions, some patients say, some folks say, it's like, if it's God's will, I'm willing to let it happen. So I do not care what happens to me about cancer, or or being screened, or going for treatment. But what do we know about what God's teaching? Faith without work is dead. Faith without work is dead. We have to do part of the work with God to have a positive outcome. So we cannot just leave it alone to faith. We need to do the work for our own healing and work together with our physician, our healthcare providers. Jesus gave the power to his disciples to do the healing. And many of us believe that the healthcare providers also were blessed with healing hearts, through a divine intervention. So faith and work together leads to healing. And it's something that we all need to understand as patients and also as physicians. So religious coping and healing, oh, sorry, there's a typo there, is healing. It's really about how we practice it. If we think that we are being punished, God is punishing us, then the outcome of how that person practices religion, his thoughts, will have a negative consequences in terms of their healing. So looking at the healing and prayer has to be in a positive sense. God, please help me, and I'm going to help myself. I'm going to pray. I'm going to ask all the other folks to pray for me, leads to positive healing. Okay. So key takeaways I want to leave you with about health and healing and medicine, everything combined in terms of care, religion, advocacy, and research, is that prayer improves mental health, and it leads to improved in health outcomes. Prayer has many benefits that can be important in the whole healing process. And watching my father, I mean, it's really in terms of the prayer and healing is about asking God for the healing and restoring your health, but also about letting go. So as I observed my dad in his whole going through the cancer and in his final stages, when a priest came and did prayer and did the blessing, it just lifted his spirit up, and he was doing well for a few weeks. It lasted a few weeks, but it got to the point after a while he was really tired of the struggle. So asking God, I am ready to let go. Please allow me to
Repta, if you
join
could
you.
round up so we can go around and we can get so others can share, and then we'll come back.
Perfect.
Yeah.
Yes. Thank you. Thank you for letting me share the key points about the importance of health, whole health, and religion. Thank you.
Thank you. Thank you. This is a wonderful topic, and thank you for starting us off. And so we will move to Dr. Balbani and hear from her, then we'll come back.
Okay, can you see my screen appropriately?
Yes.
Oh, great. Well, I'm just going to dive right in, and I warn you, we're doing a whirlwind tour. But I hope that this will be constructive to the conversation, and I think picks up a little bit where Rebecca was just leaving off. And that is, I'm just going to provide us with an overview of this research work that I did with some many wonderful colleagues, basically looking at and summarizing the research literature on spirituality in serious illness and in public health. And I just, briefly, why did we do this project? It's because there's been, a much growing research on spirituality in illness and health, but relatively little uptake into the practice of medicine. It's often not getting into high impact journals. And of course, there's some bias against the recognition of spirituality in health, varying across cultures, but frequently there is bias. However, we've seen some wonderful developments in a growing recognition that we need whole person health. We see that in the 1948 WHO definition, sort of the first evidence of a real sort of conception of health is much greater than just the merely at the absence of disease or infirmity. And then even an acknowledgement of the biopsychosocial spiritual model of health when we see the WHO definition of palliative care published in 2002, where all elements of the biopsychosocial spiritual model are acknowledged. So the goal of this project was to provide a comprehensive assessment of the literature on spirituality in medicine for ill and healthy populations, and then to name the implications for the practice of medicine. And that's what I'm going to be taking you through. So we conducted 2 systematic reviews of the literature. I'm kind of walking you through our methods. This was the systematic review of spirituality in serious illness. So it began in January of 2000, went till May of 2022. Over 15,000 papers were reviewed. Only the most robust, well-done studies were included, so many were excluded. As you can see, we only ended up with 441, but still, a good size literature with very, strong studies to look at that relationship. Very similar process was undertaken for spirituality in health outcomes, so all public health data. Over 12,000 papers reviewed, 276 that met those robustness criteria. The data were then categorized into the topics that they addressed. So in spirituality and serious illness, we had 5 kind of general topic areas that were addressed. Many continents were represented. It's largely North America, but there's actually growing literature coming from other continents, which is really wonderful to see. We get more culturally diverse information. Robust sample sizes. Again, we only took the most robust studies for this systematic review. Very similar process for spirituality and health outcomes. The studies were divided into their topic areas, representing many different continents and growing diversity in that regard over time, and very large sample sizes. You can see we're in the thousands for our public health data because of the robustness criteria that we used. So then we assembled a Delphi panelists in order to analyze those studies, those strong studies in each topic. There were 2 Delphi panelists, all sort of diverse experts in the field of spirituality and public health and spirituality and serious illness. They then reviewed the data and then provided feedback on the evidence in order to help us to understand what all that literature is saying. And then they actually graded the evidence. So this is just one example where they graded the evidence, for example, of one of the evidence statements. And we only ultimately accepted those evidence statements where there was agreement that the evidence behind that statement was strong. Then following that, we had, those evidence statements considered to be strong, divided into those spirituality and serious illness and spirituality and public health. So you can see here, religion or spirituality is important to most patients with serious illness. Spiritual needs are common. Spiritual care within medical care is desired by many patients. Spiritual needs are frequently unaddressed. Spirituality can play a role in medical decision-making. Spiritual care is infrequent in the medical setting. Provision of spiritual care, so when it's present, it actually is associated with better outcomes, and then unaddressed spiritual needs are associated with poor patient quality of life outcomes. So these were all evidence statements supported by strong evidence. Very similar process for public health. I'm just, for the sake of just brevity, I'm going to provide a pictorial diagram. So spirituality, particularly spiritual community involvement, is associated with markedly lower mortality across populations, less smoking, less substance use, less suicide, less depressive symptoms, better quality of life, satisfaction, better mental health, and among adolescents, less risk behaviors. So as part of our Delphi panelists also named and ranked the implications for the practice of medicine, and they are as follows. So within serious illness, we should be routinely incorporating spiritual care into medical care. We need to be including spiritual care education of all members of the interdisciplinary medical team in caring for seriously ill patients, and we need to be including specialty practitioners of spiritual care, whether religious community leaders or chaplains, in the care of our seriously ill patients. In health outcomes, we need to be acknowledging and leveraging the wonderful resources we have in our spiritual communities when we do public health measures. We need to be educating our public health professionals better, and we need to be recognizing spirituality in a social, as a social factor in health. So just in summary, we have these 8 evidence statements in serious illness and 8 in health outcomes, supported by strong evidence, 2 very robust systematic reviews. And there's important implications. We need to be including spirituality in the care of those who are seriously ill and in the care of communities. We need education, and we need the inclusion of chaplains and other spiritual care professionals in the care of the seriously ill, and including spirituality as associated as a factor associated with health and public health research, in community work, and in programs. So I'm just going to briefly just say what a wonderful team we had in making all of this research work possible. And with that, thanks. I will stop sharing and conclude my my whirlwind tour. I hope that's helpful and look forward to the discussion.
Yes, it was very helpful. Thank you so much, Tracy. That is amazing work. Just like with Rebecca, this is two wonderful presentations. I'm sure people have lots of thoughts. Please put your questions in the Q&A and we'll come back to those after Art Presley. I will now call on Art Presley to share with us some framing thoughts.
Thank you, and thank you for such just inspiring presentation by Tracy and Repka. I want to begin with an example of just an incredibly spiritual moment in the life of a community. And it's not only a profound spiritual moment, it's also one that helps people to recover from trauma. And we do know about the relationship of trauma and illness of all sorts. It's from the book Beloved. And after a family had escaped from slavery and the slave masters were coming to get them back, and the mother had to make a very painful choice that was disruptive. The choice was disruptive for her and the community. Later on in the book, there is this moment when the community gathers. And the passage goes, after situating herself on a huge flat-sided rock, Baby Shugs bowed her head and prayed silently. The community watched her from the trees, and they knew when she was ready, when she put her stick down. Then she shouted, "Let the children come," and they ran from the trees towards her. And she said, "Let your mothers hear you laugh," she told them. And the woods rang, and the adults looked on and could not help but smiling. Then she said, "Let the grown men come," she shouted. They stepped out one by one from the ring of trees. And she said, "Let your wives and children see you dance," she told them. And the ground shuddered underneath their feet. Finally, she called out the women and she said, "Cry," she told them. "Cry for the living and the dead. Just cry." And without covering their eyes, the woman let loose. It started that way. Laughing children, dancing men, crying women, and then it got all mixed up. Women stopped crying and danced. Men sat down and cried. Children danced and women cried. Children cried until exhausted and riven, all in each way about the clearing, damp and grasping for breath. In the silence that followed, Baby Shugs, holy, offered up to them her great big heart. When we think about this community in this town, where there's poverty, there's racism in the past, present, and to come. These are the kind of situations that we know where we see increased illnesses and disease of every sort. There is increased cancer, breast cancer, cervical cancer, increased diabetes, problems with heart rate, heart disease. We know that psychological and spiritual trauma brings about all sorts of health problems. And yet in this situation where the community comes together, something very significant is going on. This, more than anything else, is a spiritual act because community comes together. And we know that with spirituality and trauma, spirituality isn't something that you hear, that you believe in your head. Spirituality has to be something that you experience as a community. With trauma victims who have cancer, we know that the mirror neurons shut down. And once those shut down, people are not able to feel attached to their bodies. They have a dread of life. And with that dread of life, the body's basic immunization doesn't kick into gear. We know that with that dread of life, even when you're able to deal with the anxiety and the depression, that frequently the body acts as if it doesn't want to live again. We know that all of the areas of life, that when areas where Black people, particularly Black women, experience more racism, they have rates of much higher, much more aggressive forms of cancer. Where there is domestic violence, the probability of cancer goes up. And we also know that that gets passed on to their children in 50% of the time. So all of us are clear of the relationship of people's social, communal life, their capacity to learn. Where we have struggled more than anything else is how we as professionals work in an intercommunal way, how the psychologist works with the minister, how the minister and the psychologist work with the oncology team as well as the surgeons. When that happens, patients frequently need less pain medication. They're much more compliant. But increasingly, as medicine and medical care becomes more complex, people are going back and forth between 8 different doctors and 4 or 5 different community resources. And as we are aware of the needs for this interconnection, I don't know if we have enough moments like this where we talk about how to include those. And even if it's not done by the medical professions who are actually providing treatment, finding out how we as clergy and psychologists work with the families and different parts of the medical units. I don't know if we're significantly better now at actually doing it than what we were 15 years ago. And one of the things that I'm interested in is is us being able to develop those kind of strategies. When I'm talking about spirituality, one other thing I want to pick up on what Rebecca said, that the spiritual traits that are most essential in terms of people's medical condition and their psychological wellness are the traits of forgiveness because of the moral injury. A sense of grace is also important. That sense where people are thankful just for the day and they feel as though that their creator is actively involved in a very meaningful way, what Christians call the providence of God. If you've got pancreatic cancer and your family's falling behind, how do they discover the presence of God at that moment? And what is also needed is the capacity to frame all of life as being sacred. And I think that when and if those moments don't happen, if when we do that, we've got to find a way to engage the mirror neurons, the frontal cortex, and to see all of that as a spiritual movement that is done within community. And I think that people, and I like Repka's story that she told about the doctor simply allowing the family to pray. And I do think that the research would suggest that when the people believe that the doctor is part of that belief system in terms of the divine and the almighty and their illness, I do think there is a significant difference that is seen. So I would like to end here and give us an opportunity for some community discussion.
All right, wonderful. Thank you. Let us give a hand of applause to all of our panelists for this really rich conversation. We'll bring them back, everybody on the screen, so we can sort of see the questions that are here. So there's a question, should we just consider spirituality for seriously ill patients? Should we not leverage on provision of palliative care to ensure issues of spirituality are considered throughout the continuum of care from diagnosis to post-bereavement? Tracy, if you want to take that first, and then we can see if Rebecca and Art can chime in as well.
Thank you.
I know, and great question. I think that one of the reasons why there's a couple reasons why the study that I showed you, the systematic reviews were in healthy populations and in serious illness. Some of that is just because that's where the majority of the data is. So, it's either in healthy populations or in seriously ill populations. There is some, and there's growing evidence between it. But so some of it was a practical reason why, but another was kind of bookending life, right? We have when we're healthy and we have when we're close to the end of life, and we're seeing spirituality functioning in really important ways in both settings. And so it tells us, of course, it's going to be important throughout the continuum. It might manifest in slightly different ways, but one could, just the logical assumption would be is it will continue to function in important ways across the continuum. Certainly things like chronic illness, childbirth, dealing with infertility. I mean, you name it. There are so many different issues where clearly there's less data, but I think likely many similar sort of ways in which spirituality is functioning, both to uphold well-being, to provide meaning, but also a place for struggle, for spiritual struggle.
Rebecca, do you have any thoughts on that? And then Art, yeah. You are muted, please.
I would totally agree. I think it's in practicing our faith and spirituality through a continuum, whether in good health, whether in struggling health, and because we are continuously renewing our emotional, mental, spiritual health, and it provides us a way to manage our physical health as well. So it is a continuity. And I would like to just share a quote. So we have Art and I have worked on, and also used to some extent kind of on the guidebook on promoting health and sexual health in Black churches. And I asked people to comment on what does the church mean to them, what does it represent. And I would like to share one quote that's, I think, applicable here, that presents that it is a continuum. We always need the presence of the spirituality within us. The church provides me with a refuge from the struggles of daily life, a place that renews my spirit and provides a place of fellowship and community where one can worship God, giving thanks for all that I have and all that I am continuously. It offers guidance and instruction regarding how to live one's life as it relates to the word, lifting up the Bible and demonstrating its applicability even today, every day, no matter the circumstances. And that was a quote from Lene. I think that is in Atlanta, and I think that's absolutely beautiful.
Thank you.
Thank you. I really like both of their answers. I think that epidemiological studies sort of may help connect the two, the beginning and the end, which says that there may be some things that we see early on that lets us know that if we don't attend to some of these problems early on, something major will happen. I think that when you've seen a complicated grief, for instance, that has gone on for 2 years, people's immunization starts to shut down. When children have experienced certain kind of developmental delays, they aren't able to graduate from elementary to high school. That if you've got children in urban areas that have experienced more than 1 or 2 forms of violence, and there's other social problems in the community. So there are things that we can sort of check and look at And maybe when they go to their pediatrician or their doctor, those are some of the things that get talked about with the doctor and the social worker, then saying, here are some things that we want you to do. And then you can audit to see whether those kinds of things that are happening. So we have watched enough illnesses, minor and larger, take place over a long period. Some of the studies, similar to Tracy's, take place over a 20-year time period. And they kind of know what those surrounding conditions are, whether it's poverty, not just poverty, but when people experience this as poverty, and I've experienced race, and there's been a certain number of shootings, that those children are going to develop a certain number of things. And we can start putting that data together and develop programs. It's just, it's a lot of coordination between organizations, which unfortunately frequently are already overwhelmed with just their simple task at hand.
There is a question in the chat about how do you maintain a positive spiritual view on life through hard diagnoses and hard situations, etc. And so I wonder, Tracy, in your work, how do people maintain that spiritual outlook? Have you observed people who flourish even when they've been diagnosed with cancer?
Yeah. So I'd love to hear what Rebecca and Art would share as well on this, but they're wonderful. I've had some wonderful case stories already, but you know, for certain, you know, when you look, so just speaking from as a researcher, you know, when you ask patients, I've done some work where we, you know, ask patients, you know, how spirituality has been functioning in their illness, and you know, there's actually been a variety of studies done in this regard with some consistency on what's said, and it's the most frequent ways that it's functioning to help individuals to absorb the stresses of illness. And that's what it does. It's helping people to absorb the stress and to maintain a sense of their you know, personhood, meaning in the midst of illness is I think Rebecca mentioned this as well, is coping, having, you know, how it's providing coping, it's providing practices like prayer, I think also referred to. It's providing, there even can be a deepening. I mean, yes, there can be struggle. A lot of spiritual struggles can happen, but, you know, as one moves through those struggles, oftentimes there can be a deepening of one's faith. So there can be transformation where people actually grow spiritually in the midst of the hardship of their illness, which is a beautiful thing to witness. I've witnessed it in my own patients, and it's so inspiring to see that, to see how the, you know, in the human spirit, we can actually grow even as our bodies are dying and as we face suffering and tragedy. And then another important theme is that of community. It's the community, the spiritual community surrounding us that can help, they can help us to hold on. You know, suffering can lead to disintegration of personhood and disintegration of one's spirit, right? Yes, we can find that individually in our connection to God and in our connection to that spirit, but we can struggle in that. But the people around us can help to be, they can also help us to uphold our own sense of personhood, meaning and value and connection to God, and because they themselves help to hold on to that for us. So anyways, those are some of the ways in which you can see that it actually can contribute to absorbing the difficulty, the suffering that comes with serious illness.
I totally agree and support that. And you know, there's the individuality where, you know, individuals' connection with their spiritual life or with their God. There's also a communal relationship, right? So we tend to seek group prayers, family prayers, church, you know, all the time I announce we're going to be praying for so-and-so on the list of prayers, because I mean, in Acts, right? And Acts, it talks, the book Acts talks about the importance and the value of collective prayer, the strength that comes out of that, the recovery that comes out of that. So there are so many ways that praying for self and praying together can actually help. And we see results in terms of pain relief, or being able to manage the pain a bit more, because you're more uplifted. I just shared information about my dad and his dying, and how, you know, with prayer and gathering with a spiritual leader uplifted him. You know, so not only about managing pain, but also, you know, prayer and strength and connectedness to your religion kind of boosts your immune system also, and ability to fight diseases and to fight illnesses. We see miraculous stories all the time, some that physicians cannot really explain what is going on. And in some cases, it's like the strength of the prayer. And we have to believe there's outer force beyond our medical practice that is very influential in how healing actually happens. Medicine cannot fully explain some of what actually happens. And also in cancer research and interviewing breast cancer chemo women, they revealed that those that are connected to family, have a family circle and family support circle, and connected to their church, have a better way of handling their chemo treatment process. So those are some of the ways in terms of how that spiritual connection help us with manage our illness better.
Art, before you jump
And
in, let me just connect that to a few comments that I see in the chat as we're running short on time. So one is sort of how should we understand the term spirituality? What might it mean? It's a big topic, obviously, but if you can just, and then there's a question there about do any of you, and we'll just answer this very briefly. Can you talk about how you think AI might help in the spiritual component? So that's a big topic, but 30-second answers would be helpful. Go ahead.
I want to use part of my 30 seconds just to say something about Tracy's study. When you look at the names, you're looking at kind of Hall of Fame, basketball dream team, baseball murderers row. It is an awesome group of scholars who have been leading the field for 30 or 40 years. So I do hope everybody will harass her to get a copy or to find a copy of her study, but it is such a fantastic group and that you've put together, which is phenomenal, which offers something to all of us. I think of spirituality, just briefly in terms of prayer, for one, I think it's important that people do what the community did, where they are together watching each other pray. And as they talk about community, that sense of being with community is important. I think Larry Dossey has done some interesting work in terms of even prayer at a distance. So part of being part of that community is not only in the room. And I think AI connects what Larry Dossey talks about, that in distance intercessory prayer. So just those two things very quickly.
Thank you. Tracy, and then Rebecca, briefly on AI.
AI. Quickly on the definition.
Okay.
So just because it's a really important point, it's, you know, what I've used and others have used has been this International Consensus Conference on Spirituality and Palliative Care, led by Christina Pekulski and others, definition, which I won't go into detail. It's actually a researcher's nightmare when you read it, because it is so expansive, but it's actually the reality. Like, the reality is that spirituality is it's a very all-encompassing definition. It would include any religious tradition, spiritual, not religious. It basically would say that we all are And so it's trying to name all the various elements of how spirituality might be manifest. And I think having that sort of all-encompassing definition, yes, it's hard on researchers, but it's actually the most realistic, because that's what humanity is. But an important point that we need to understand when we're talking about it, what we actually are talking about. And then in regard to AI, that's like a very interesting question. So I would love to hear what my panel colleagues, maybe I will defer, like punt a little. But I wonder things like, and I apologies that I speak at this so much as a researcher. I do have personal experience as well. But I wonder if part of even you having, employing AI to help us to see how when you look at things like support group chats or, you're going to see that spiritual themes are going to arise all the time, and how it's just another, you could actually use it as a tool to actually help to illuminate to people within healthcare the importance of spiritual concepts and things like that. So that was kind of my first thought of how to practically use it for that purpose. Providing spiritual care through AI makes me a little like, I think there's something about having human connection that kind of raises kind of questions in my mind, and I'm not sure where to go there, but I haven't spent a lot of time thinking about that. But my initial is that there needs to be human connection involved, not computers.
I will just be extremely brief and add on to the AI piece. And I think we're still learning a lot about AI, even just in terms of technical application and all that. But in terms of health, in terms of healing, I would say that I know one of the struggles that we have in the United States is the extent of loneliness and isolation that people feel. And AI has been able to really help some who do not have connection to humans for a variety of reasons. And AI in those circumstances can actually be, a friend. And we know there are even relationships and like love relationships. I do not want to put value statement on that, but I do know that people are beginning to have romantic relationship with with AI, but actually using AI for healing, if it really helps them, if they're disconnected from a social circle, I am totally fine with that. Wherever you get the strength, the connection, the feeling of comfort and connectedness that helps support the healing, I'm fine with that. And AI can play a role, and we can support that, all of us. Yeah.
Thank you all for this. We are at time, and I want to invite. Presley, you were going to say something.
No, we're over time, and
okay.
so like always, I've got
this
three more
series,
things.
the GHC series continues, and I want to invite Stephen Avery to come to tell us about what's next on tap for us.
Thank you. Yeah, I enjoyed this panel. Kenneth, this is my favorite session of the GHC.
I know.
So quickly, our next session in this series is March 15th. The session is titled "The World's Premier Global Oncology University: Opportunities for Harmonizing and Building the Oncology Workforce of the Future." So we'll explore innovative strategies to transform global oncology education and workforce development. And it kind of picks off of the last question. We'll look at AI, VR, holograms. How can we leverage all of these to enhance training and collaboration and capacity building? So hopefully people can join us in 2 weeks for another very stimulating session. Thank you.
Thank you so much, Stephen.
Thank you.
And thank you to Tracy, Rebecca, and Art for this really engaging, stimulating conversation. It's a big topic. It's not going away. The world is a scientific world. It's also a religious world. And we are trying to put both of those together. So thank you to everybody who took time to be part of this webinar series, and hopefully you will continue to join us in the coming weeks as we continue to explore this big topic about how we heal ourselves and heal the world. Thank you, everybody. Have a wonderful day.
Thank you.
Yeah.